Welcome to today's talk session. My name is Deidre Moss, and I'm the host of Can We Talk? I'm an educator, motivator, and a talk connoisseur. In our session today, we will focus and talk about heart health awareness, as February is Heart Health Awareness Month. We thought that talking about heart health awareness is an important topic, and we've invited our most informed guest to present on this topic. So I'm so excited to have her here today to join us in this regional talk. We're excited to welcome Barbara McGaw. I don't know if there's a doctor in front of it. I just want to make sure.
No.
Okay. Just want to make sure. Barbara McGaw, her credentials include the project manager for the Global Health Advocacy Health Project, the Health Foundation of Jamaica, Tobacco Control Advisor, Jamaica Coalition for Tobacco Control, and Healthy Caribbean Coalition, right?
Yes, a mouthful.
Awesome. So at this time, I will pass the virtual mic to our guest as she introduced herself.
Okay, Deidre, I want to thank you for inviting me. And I can sense that you're as passionate as I am about health and healthy lifestyle, especially in the current day. So my name is Barbara McGaw. I've actually been working at the Health Foundation for around 14 years. The early part was in tobacco control as project manager for a project within the Jamaica Coalition, and then more recently with the food policy project, which is looking at healthy eating. I am a proud mother of 2 grown children and married, coming up 35 years, thanking God for every day. Thanking God for that.
Awesome. Thank you for that introduction. So can we talk heart health awareness?
Okay, so let me tell you a little bit about the Global Health Advocacy Project. It's a food policy project that aims to increase public support and obesity for NCD prevention policies through advocacy, decision makers, lobbying, and so on. We work very closely with the Ministry of Health and Wellness and other NGOs and civil society, and of course, medical organizations. Just to tell you a little bit about heart health. So, what does the term heart health encompass? Well, actually, this month is a very important month because it's Heart Month, and it's celebrated every year at the Health Foundation, where we have a lot of activities. The heart health, we are trying to get the general public to indulge in lifestyle habits that improve heart health. Heart healthy living involves understanding your risk, making informed choices, taking steps to reduce your chances of getting heart disease. A healthy heart is central to overall good health, and embracing a healthy lifestyle at any age can prevent heart disease and lower your risk of a heart attack or stroke. So, and again, if the heart isn't working as it should, numerous health problems can occur, including high blood pressure, high cholesterol, stroke, and heart attack. I wouldn't say the simple solution, but one of the solutions is know your numbers. You need to know your numbers. And one of the ways to do that is screening. And that's one of the things that the Heart Foundation does a lot of. We see over 100,000 patients a year at the Heart Foundation, and we actually have mobile clinics that go out to the countryside. The screening numbers, blood pressure, blood cholesterol, fasting blood glucose, and body mass index, which is your height versus your weight and how that affects other things. So those are the main things that you need to improve heart health, so to speak.
Thank you so much. Thank you. So I just want us, scale back just a little bit. We talked about your credentials. Can you give us just a little bit more into your background and really how you would have gotten involved, just a little bit if you can?
Okay, I actually trained as a biochemist. So I went to University of the West Indies, and then I did a master's in biochemistry. I actually work in the pharmaceutical industry for many years. I used to come to Bahamas. I had some good friends there too, because as a medical rep, I would visit the doctors and so on. And then there was a lot of mergers between pharmaceutical companies. So then I worked at the university in an HIV/AIDS training capacity to help healthcare workers be trained on HIV management. So that's what I did. And then sometime after I got a call from the Health Foundation, they said they want somebody to do tobacco control. I'm like, what's that? Tobacco control? I knew nothing. This is 2008. And I came, and then I really, really got hooked into it, meaning that there was so much that needed to be done to make people aware of the dangers of smoking and the long-term health challenges. Because the thing is, at first, everything is fine. And the young people say, what are you probably, what are you talking about? But it doesn't happen right away. But the fact is, you're laying the groundwork by smoking. And we were very upset to see how tobacco companies would be promoting to children, promoting to the youth, even though they say they're not, you know, and some of the activities that they would do. So I did that for a couple of years. I'm still working, you know, as I said, as an advisor in that area. But then in 2017, we got funding from the Bloomberg philanthropists to look at food policy programs, things like front of package labeling, school nutrition policy, you know, because we have to try to help the in-school food environment for children, and things like bans of marketing ads to children, because that's another thing. You know, they said that the M for McDonald's is like the most recognized logo in the world. I read that somewhere. I was like, whoa, because I remember you go to China, you go to Russia, anywhere, that M. Children can pick that up and they know it from a very young age, you know? So I've been involved in advocacy for a number of years, and prior to that, HIV/AIDS training.
Thank you for sharing that. So you have a long history in health, really,
yes,
and you've
yes,
kind of transitioned from different areas.
Yes.
So thank you for sharing that. And so in your role, you talk a little bit about, you know, being the in the search for an advisor for the Tobacco Coalition,
Yes.
and tobacco controller. So you
Yeah.
assume several roles.
Right.
So can you tell us about your role and responsibilities? Because you have several roles.
For which one? For the tobacco? Or
right.
For
you have several. You have several. But as the project manager for Global Health Advocacy Health Project, the Health Foundation of Jamaica, you know, and can you also tell us about your role as the tobacco control advisor? So you've assumed several roles, and if you want to touch on each of them, that's fine as well.
So,
yeah.
Fine. So let me tell you a bit about the tobacco control advisor. I've been an advisor for 5 years, but prior to that, since 2008, I worked as a project manager for Coalition. The role is to support the delivery of evidence-based strategies to help reduce tobacco consumption, and more importantly, to encourage persons not to start. We were very fortunate. We worked very closely with the Ministry of Health, and I must say, I worked to support when the tobacco control bill came into Jamaica, the tobacco control regulations in 2013, which banned smoking in public places and asked for labels on cigarette packages. So again, we work very closely there. And then recently, the new Minister of Health has submitted the Tobacco Control Act 2020, which is a more comprehensive act, which will cover things like tobacco advertising, promotion, and sponsorship, and so on, because the first regulations didn't cover that. So it's an advocacy role, sensitization. You know, we were able to get some. They have this model that you can get from, I guess it was from Amazon or somewhere. It shows the healthy lung and it shows the disease lung. And Deidre, when you look at, when we go out, because we go out and do outreach and demonstrations, and when people see that disease lung, they go, you know, they're like scared. They just don't know. You know, that's what's happening to your body. So it's more important on letting people know, sensitizing them, you know, about the issues and what's the problem, you know, with tobacco. All right, so talk a little bit about the global health. Right. So first off, just to say that the Heart Foundation actually has several areas that they work on. Screening, as we talked about, advanced cardiac services, where we have cardiologists and medical staff, and a host of professionals that work with persons to improve their heart health. Health education and training, this one is important. CPR, first aid training, So people can come. We're a center for training because and the courses are endorsed by the American Heart Association. Apparently, a very high percentage of the heart attacks that happen outside of hospital settings, the patients die. But if they have CPR, they're actually able to have a chance, you know? So the Global Health Advocacy Project now, we work with our local and regional partners to support a healthy Jamaican population. There are 3 or 4 things we're really working on. Pushing for front of package labeling. Because again, if you go into the supermarket later and you look at a product and you turn the back and you see the nutrition information, you have to stop and do a little calculation. Because sometimes you'll say 10 grams and say, oh, well, that's not too bad, but it's 2 servings. So it's 3. So the front of package labeling makes it very easy. At one glance, they're at the front and they say whether you're high in fat, salt, sugar, or so on. Now, that doesn't mean you don't have to buy the product, but at least you know. So what we're working is that people have a right to know what's in their food. And there is a particular front of package label called the high in octagon. And that one has been shown to be very effective in many studies, Mexico and all over. However, in Jamaica, in December, Parco did a study and they did 5 labels and they found that octagon label was the best. But we are getting a little pushback, you know, to try to have through the Bureau of Standards. You know, we are supposed to have this standard and approve it, and then it was approved right around the region. It's a Caribbean standard. But unfortunately, Jamaica did not vote for it. Other countries did, you know. The other thing is the school nutrition policy. Now that policy is in draft and it's quite a comprehensive policy. What I must say, the Ministry of Education, they reached out to various civil society organizations and we're seen as very strong in that area. So we were allowed to review and make suggestions on the policy. So once that's implemented, that will be wonderful. But of course, it's the monitoring. So it's all implemented and, you know, how much sugar should be in the drinks, what should the canteen serve. But the next step is to monitor it to make sure that it's done. But at least once you have a policy, it's a start. It's not perfect, you know. And then, of course, as I mentioned, the marketing restriction to children. We would like to have some sort of control about, you know, the marketing to children. Whether we do, you know, look at controlling the ads or, you know, the TV. I don't know. We're kind of just working on that. So those are all the things. We also were looking at a sugar sweetened tax. And we did that in 2018, and that got a lot of flack, both positive and negative. Positive because the funds can then be rechanneled into NCD prevention. Because 80%, 70 to 80% of the deaths in Jamaica, and I'm sure Bahamas is the same, is it's the non-communicable with diabetes, hypertension, you know, cancers, respiratory diseases. And the fact is, no Ministry of Health has enough money and time to put that together. So if we could do more public education with prevention, you start in the schools, you do your outreach, you do your radio announcements, you do your TV ads, you know. The thing is, the difference with tobacco, there's no safe level of tobacco. So when you get that across to the policymakers, nobody's for it. But if you want to have a soda and you want to have it, you have it every night. But if you go and have it once a week, it's okay. It's not as if, you understand? It's a matter of portion control. But if you don't know how many teaspoons of sugar are in one of those sodas, until you see it, you're not going to know, you know? So that is what we're working on at both levels. So we're working at the policy level, but we're also working one-on-one. We go to a school, we go to a church. The other day we went to the Exim Bank. They wanted us, their workers, they were trying to, you know, motivate the workers to be healthy and so they had an exercise and healthy eating, you know, program. Ministry of Finance, we did that last week. We've done, you know, churches, we've done all sorts of organizations, you know. But the fact is, it's sharing that information, Deidre, that makes a difference.
Yes, and that's so important, and that's so vital, as you would have mentioned. Sometimes you see those pretty packaging, and you're not really
Yeah.
thinking about all of those things
No,
that is in it, that
no,
level of the amount of
no.
sugar that is in those
Yeah.
sugary drinks. So
Yes,
kind
yes,
of making that information available and letting us see
yes,
exactly the amount that is available can help you kind of think about it just a little bit. And
yes.
also, I hear about your passion as it pertains to informing the public and starting
Mhm.
at reaching those kids at the early stages.
Yes,
And then you
yes.
also talk about non-communicable diseases, and
Mhm.
particularly, in your country, in Jamaica, but also in the Caribbean as well as a regional
Caribbean.
thing. We're impacted a lot by
A
diabetes,
lot,
hypertension,
a
all
lot.
of those non-communicable diseases. So thank you
Yes,
for highlighting that. And so
yes.
because the focus, oh, you wanted to say to add to that?
Just to add, that's part of the work I do with the Health Caribbean Coalition, because it's a coalition of civil society members over the entire Caribbean. And a lot of the projects we do are being done in Barbados and St. Kitts and some of the other countries. And the picture of overweight and obesity is the same everywhere. It's the same, So we have a common problem.
Yeah.
We may not have a common solution because it's different. No, because again, just look back at our national dishes, like macaroni pie.
Oh yeah. Oh yeah. Oh yeah. Oh, don't go there. Don't go there. Don't go
Okay.
there.
But if you have it maybe once every 2 weeks, but if you're going to have it every night, then you're not.
Yeah, that's a staple. No, that's a staple dinner. That's like you have to have macaroni and coleslaw.
Exactly.
You gotta put the sugar in the coleslaw. That's a staple
Tell
dinner.
me about it, girl. One thing I love about Bahamas, you're in the Bahamas, right? When I came there as a rep, I go under the bridge and get my comforters. That's the first thing as I come off the plane and taxi comes for me.
Did you get your conch salad? You get your conch salad?
Conch salad and the conch fritters. But you know the conch fritter, if you squeeze that in a tissue,
Yes.
oil.
Yeah.
But I'm telling you, once I get to Bahamas, that's the first thing I go on for is my conch fritter under the bridge. Okay? I'm just saying, at the time, you're not thinking about the total health issues. Yeah. But luckily, I didn't do that often, so I didn't feel too bad because I was eating it every day.
These are our staples because you have your cod fish and what's the dumplings, right?
And the fried dumpling and the festival. Yeah. And they put sugar in the festival. Yeah. And then you have the fried fish. It's lovely. It has a little pickle, but it's fried in oil. Yeah. And it's so good. And
it's good. It's great.
It's so good. And I know in Trinidad they have shark and bake. In Barbados they have macaroni pie as well. So,
Oh, I thought macaroni pie is Trinidad and Tobago.
I think it's Barbados, but then they have adopted it from each country. Who knows?
But we have our macaroni, and in that macaroni is tons of butter.
I know.
All the cheese, and then you put the egg in it too. So yeah. So we have to think about those things, and why we are high, as it pertains to non-communicable diseases. We have those high rates.
The percentages are very similar around the Caribbean compared to maybe other countries, But the other thing too is there is this perception that healthy food is expensive.
Yes.
I wouldn't say it's a perception. I think to some extent it can be.
Yeah.
But you can always find your way around it. Like you come home and cook instead of getting fast food or getting takeout, and you're doing rice, do pumpkin rice. That's what I did. You cut up a few pumpkins in it and maybe some carrots. So you're having the rice, but then you have a little bit of vegetables in it. And of course, if you're going to do the chicken, you steam the chicken or bake it instead of frying it. Although the fried chicken is the best. So this is what I'm saying, is what we grew up with. Yeah. I can remember growing up when we come home, when it's fried chicken for dinner, everybody come home early.
Yeah.
And you better come home quick in case you don't get your share.
Okay. Yes.
But I just think an informed citizen is a better citizen.
Oh yes, definitely.
And we have seen changes. We've seen one person at a time who have in fact, when we were doing our campaign against sugary drinks, when we had a mass media campaign with ads and TV and so on, and then we did a post-campaign evaluation using focus groups. And people were saying they are willing to change their ways. Some of them
Yeah.
stopped drinking the sugary drinks or reduced it and started to drink more water.
Yeah.
You know? But the thing is, the behavior change, as you know, is challenging.
Yeah.
And I don't know, I wouldn't say it was continued forever because the ad campaign can't continue forever. We're not a national, we're a small NGO, you know? But if say the government had the funds or the ministry to continue that type of education, you know, it would have helped. But we did get things and we understood that some of the companies that sell water, even though they sell sodas, their water sales went up. People were drinking water.
Yeah.
You know?
Thank you. Thank you for sharing that. And so, you know, we're February, we're in the month of love. This is Heart Health Month.
Yes.
And so can you tell us, you know, what is heart health for some persons who may not fully understand really and truly what is heart health?
Okay, so I talked a little bit about heart health, but let me talk about heart health issues in Jamaica, which is very similar to the Caribbean. So the Health and Lifestyle survey that was done in 2018 is showing that 33% persons came in with high blood pressure, 1 or 8 with diabetes, and there's a high prevalence of CVP risk factors, as we talked about that. But I think also, Deirdre, what has had an impact, and I'm sure it happened in the Bahamas too, was the COVID. Because again, you were locked up at home, you weren't able to go out and exercise. People just were ordering in food because I don't know about Bahamas, in Jamaica, we have had a huge increase with home delivery, which wasn't really a thing here with the little bikes. When you drive on the road now, there are like 10 bikes passing you. I think there are around 5 companies that have set up since COVID. Fantastic. So from that point of view, people got a job and people were able to get convenience. But because of that, plus I know I had low grade depression. You're locked up in your house, you can't go anywhere, you have, you know, even the bubble that you have, you're nervous. So you eat, you just, you know, you break the chain. You do things like that. So we know that there has been an impact on heart health, probably for most of the persons, you know, and quite a few people have put on weight. What we noticed with the children, because school was out and they were at home, homeschooling, they're on the tablet all day long. They're not outside playing, they're nothing. So that had a, you know, effect as well. So there's actually a study that was shown in UTech, University of Technology, that looked, just recently published. It highlighted the impacts of COVID on the physical activity levels, mental health, and diets of Jamaicans. And the statistics showed 80% of the respondents sharing said they have gained weight, and a significant number of persons reported risky health behaviors such as and coping mechanisms to combat the stresses of COVID. You know, so there is a real challenge on heart health. But the key is self-actualization, self-realization. Visit your doctor, your health center, and get your numbers. And finally, some people don't want to. They just, I don't know.
They don't want to know.
No. I have to say, the Ministry of Health have been doing their best because they have an NCD unit and they do try, you know, and then of course there's a whole set of clinics and so on. But it is challenging because now the impact on the hospitals is COVID. So even persons who normally would go for their 3 monthly heart checks or their blood pressure checks aren't going. And even if they go, the hospital is full. So they're not even able, or the clinic is, you know, they're not even able to, you know, to get the care that they need, you know. So that's about it.
Yes, definitely. Thank you. And I know you shared some statistics about heart health in Jamaica. I know you shared some statistics, but what are your views on heart health awareness? Not only as it pertains to Jamaica, but in the greater Caribbean.
So yeah, I think that the heart health awareness is low, as you can imagine. For some of the countries that have like cable television, because you know we have our local stations and we have cable, there may be 1 or 2 of those stations that actually show you know, health messages, especially I've seen some for tobacco. like, you know, a man with a big hole in his throat saying, you know, and he can't talk and that kind of thing. I just think for the persons, they're still unaware that non-communicable diseases and hypertension are related to cardiovascular deaths. So that is, it's just a matter of, again, public education. And you see, things have changed. For example, in 2008.
You skip over that. That's so important. Could you repeat that? You talk about non-communicable diseases being related to, could you? Yeah.
Yes. So the overweight and inactivity actually can affect directly the non-communicable diseases such as hypertension, diabetes, respiratory disease, and even cancers. You know, and some of them will cause that. So it's a matter of awareness. I think once the people you can actually reach the people and they will come into like a heart foundation, because we have clinics, we have screening, or they go to their doctor. But people don't really want to know, you know. And unfortunately, what they do, they wait until maybe they start to get symptoms. In fact, there was another study in Heart Foundation done recently where like 30% of the persons came in with hypertension. More than half of them did not know they had hypertension and were not on treatment. They're walking in just to get their checks, and they weren't aware, because remember, hypertension in the beginning, you don't really get any symptoms. You might get a headache or so, but you don't get symptoms right away. Later on now, you know, it can cause, you know, cardiovascular events, you can have other things. But straight up, same with diabetes. In the beginning, you may not have specifics. You might have hunger, you might have, frequent urination, but that's not, you know, like, suppose you went to a party and you had a whole heap of drinks and then you came home, you might say, well, it was just that, you know. Hunger is not really known as a symptom, but when you put them all together, or like somebody who gets a cut and it doesn't heal, these are the things that they might go to their doctor and realize that their blood sugar is high. You know, so even the persons who are coming in to the Heart Foundation and probably to clinics all around the Caribbean, a high percentage are not aware that they have high blood pressure or high sugar. They're not aware of it. And that's why it was so important, I guess, you know, to know your numbers and to do screening, which we are doing this month, you know, for, because it's Heart Health Month in Jamaica.
Thank you. I know you may see me looking down. I'm looking for comments. And I just want to, at this moment, I want to acknowledge those persons who are listening in. If you have any comments, we're going to acknowledge your comments. So feel free to comment in the chat. Let us know your thoughts. Share with us today. We're happy that you're joining us. And you can also share this session as well. Share it on your page, like and share. But if you have any comments, feel free to add. We would love to hear from you. And again, thank you for listening in. Thank you for listening in. I don't know if Ms. Pitta's listening in. She's our regular listener from Jamaica. So we love you, Ms. Pitta. Okay, so getting back to our question. So are you satisfied? I know you assume so many roles and so many responsibilities.
Yeah.
But are you satisfied with the response from the community as it pertains to heart health awareness and prevention of heart health issues in Jamaica?
To some extent. But what I'm saying, again, it's the whole issue of access to care. And we have to realize in the last 2 years, everything has changed. So the goalposts have changed. COVID could be used as an excuse, or it could be a real issue. Some people have lost family members. Some people have been very sick. There are people with long COVID months after, you know, are still not well. So what happened is change the whole process. And even access of citizens for regular health care is a challenge, because the hospitals are overwhelmed and the clinics are overwhelmed. And then, for example, people going into the hospital now have to do a COVID test So they can't, before they even can treat them, they may start to treat them, but they can't admit them until they do the COVID test and get the results, because if they have COVID, they have to go for isolation ward. But if they don't, they have to go somewhere else, you know? So I think the whole COVID pandemic is changing the whole issues of health and heart health. Plus the fact that people are eating more, people are put on weight, people are not taking their medications. They may not finish their medication. They start it, you know, it is. After 2 days, you feel good, you stop. You know, so I think it's two things. Continuing public education, and as you said earlier, the children, get them from early. I remember when we were working in tobacco control, we had an outreach, and this guy came to us, and he was like, he said he stopped smoking because his little daughter came from school, and she had learned in school about smoking kills. You know, one of the, you know, the HLFE, that's Healthy Life curricula for schools. And she said, Daddy, I don't want you to die. And he was just so traumatized that he stopped smoking. But for years and years and years, he was trying, and he did not have that motivation to stop. But because his little daughter came and, you know, she was so concerned about her daddy. So I think the ongoing education, the ongoing public education, the messaging, and also when we started in 2008, you didn't have like social media. Now it's much easier. That you can send out messages, people, everybody has WhatsApp, everybody has phones, but it's also a challenge for the marketing too. So the kids are on the tablets, and there's ads for fast foods right at the bottom of the screen, and there's ads for drinks and so on. So it's a double-edged sword, because the people in the industry also can reach the same people that we're trying to reach. So we really have to, I don't know, well, hopefully it looks as if we're out of COVID, like we're a little bit out, because we now need to really address the health issues, not just heart health, but all of the heart, you know, all of the health issues that have been sort of left behind, if you know what I mean, you know?
Yeah, that's an important point that you made in terms of addressing all issues, all of the health issues, because, you know, for the most part, as you would have mentioned, particularly as it pertains to hypertension and those non-communicable diseases, they kind of have an impact on the heart as well. And so it is important that you mentioned that they do have an impact, you know, and, you know, can further impact your heart health. So those issues should be examined. So I want to thank you for making that point. And also initiatives. And can you tell us about any initiatives that your group or that you, as the project manager of Global Health Advocacy, have undertaken to address heart health issues and heart health awareness in your country?
Okay, so one of the things that we have done, as we mentioned, this month is Heart Month. What we have done is we're having outside broadcasts, radio programs, mobile screening. The Heart Foundation is actually going to go to several old people's homes to monitor. You know, they're going to go and actually do screening for all the patients. And the Heart Foundation also does mobile services at different Ministry of Health clinics. And these are all over Jamaica. So that's one of the things we'll be doing. Of course, we have a medical symposium to update the doctors, you know, about what's happening the latest with heart health. Again, we're encouraging people to come to be screened at the Heart Foundation, and also to do the courses that I talked about, the CPR, you know, and the basic life support, because those courses can actually help you save a life. And again, it's just, again, the constant public education, and we work closely with some of our other NGOs, like the Jamaica Cancer Society, you know, the Diabetes Association of Jamaica. So there are several civil society organizations. In terms of our project, we are going to continue to advocate for front of package labeling. There was a little bit of a dip, but we found recently that there's a Jamaica economic panel. They looked at the whole obesity thing in Jamaica, and they are recommending fiscal policies such as taxes and using the money to work for to fund preventative issues. we have to look at
Could you repeat that? Could you repeat that? That's important.
The Jamaica Economic Panel, there was an article in yesterday's newspaper. They met, it's between the Department of Government at the university and some of the UN agencies, and they were commenting on the issue of obesity in Jamaica and its effect on all the things that we mentioned before. And they were of the opinion that fiscal policy, meaning introducing a tax on high sugary foods or unhealthy foods, would help. It helps two ways. If it's more expensive, you may be less likely to buy it.
Right.
And the funds that are collected for this tax can be used to fund prevention issues within the hospital, within the health center, within the Ministry of Health. So
so that's something that's being brought to the table. Interesting. So you're levying a tax on those sugary items, and
they're proposing it. Because remember, you're going to get kickback. You're going to get pushback from the industry.
Right.
The industry is the industry, and they are here to sell you the products. You know?
Right, but that's interesting. That's interesting. Yeah. I don't want you to glaze over that though. I want because
no. And what I can do is send you the article because it came up yesterday. It was actually well done, very well written. So we at the Heart Foundation, we jumped on that and said, okay. So we are going to write a letter to the editor supporting this thing and maybe asking for a meeting. Because this is now academia and the UN agencies. The next step is to get the government involved now, you know, to get the government involved.
Awesome. Interesting. So it is a proposal to levy a tax. It's not implemented. Just want to mention that.
No. It's just a proposal. It's a proposal, and it's just generic at this point, looking at unhealthy food. But they did mention Mexico because Mexico put a tax on sugary sweetened beverages around 4 years ago.
Oh, wow.
And they have shown reduced consumption of the sugary drinks. Definitely. 10 to 15% reduction, plus the funds that they have would then be pumped back into the public
preventative measures. Right. So this is already being done.
That was done at Barbados and St. Kitts in the Caribbean have put us a sugar sweetened tax. Barbados did it about 3 or 4 years ago, and so did St. Kitts. So we're waiting to see the research. The thing is though, some of the people, the naysayers said, so how is it going to affect obesity? It cannot affect obesity right now, Deidre.
Right.
Because it took you 10 years to put on the weight. Don't expect in 2 years. So in other words, it's a start.
Right.
But research is being done to see the effect of those countries when they put the sugary drinks tax. And it reduced consumption. In the long term, hopefully you would see some effect on overweight or obesity, but not right away.
But that's interesting because for the most part, you want to buy those things because they're cheap. So, you know, if you make it more,
exactly. It's a challenge.
Yeah.
One of the other things that we mentioned before is to put in place that school nutrition policy, because then you're controlling the school environment in terms of what the children are eating. And we did a survey on school use and what the parents were saying. And the children, most of their time is spent at school, you know, and most of the food they get at school. Because, you know, in Jamaica, they have the PATH program where they give them breakfast when they come in and they get lunch and so on. So the percentage of the day that the children spend at school is actually more than at home. So what they eat at school is very important. So we're working, you know, really on that. We want to look at, of course, the restriction of the marketing now. If we can get that to happen, again, through the government and through the broadcasting commission, you know, to see how we can have that done. Other countries have done that. I think Brazil and a couple of other countries, like between certain hours, no advertising for fast food or sodas. It's just blocked.
Awesome. But thank you for sharing that. I want to just give a shout out to our viewers, Ms. Vivian Pitter, Vivian, we miss you. This is Vivian Pitter from Jamaica. She says, great topic. Thank you, Vivian. Thank you for joining us. And then Miss Lynetta Weaver. Miss Weaver, thank you so much for joining us again. She says that needs to be implemented on all Caribbean islands.
Yes.
And use the funds for research and educating on wellness. Miss Weaver, I think you're from the US. Can you, in the comments, tell us, how are you impacted? How are you impacted from heart health issues? Maybe you can share something with us today. So we would love to hear. I'm going to check back on your comment with Ms. Weaver, but thank you for joining us. Okay. So you were saying something. Did I interrupt you?
No. We were saying about the restriction of marketing to children. The other thing that we want to look at is the unintentional consequences of corporate social responsibility and conflict of interest. For example, it probably happened in the Bahamas too. The food industry donated food to the frontline workers and they gave food to the old people homes and to the schools. Fabulous. But what is the content, the nutritional content of those foods? So you're very grateful for it because you wouldn't want a healthcare worker to work 24 hours and not get any food, you know? But how does that set up? How does that set up the persons? And later on, when we're looking at front of package labeling or any other policies, sugar sweetened taxes, these food companies and these industry people, they have donated ventilators, they have donated PPE, wonderful. You know, but how does it look? How does it come out later? That is one of the challenges that we have. You know, so not much we can do about it, but I'm just airing it as a challenge. You know.
Are you talking about the food? You talking about the food packages?
No, not food packages. For example, in the newspaper we have something called Helping Hands, and the whole page with all sorts of pictures where the healthcare workers got pizzas. Or they got bags of chicken, or the old people's home got high sugar drinks that would put them in a coma. Most of those old people should never be drinking that. But it was and people are grateful. So it's not the food packaging, that's awesome. Because then you get some flour, some rice, and something, and then you make your stuff. You know, but I'm just saying that there was a lot of that during COVID. And it is necessary. But we feel later on when policy decisions are going to be made, how will that impact the policies that need to be put in place?
Yes, thank you, definitely. And so we come to recommendations. What recommendations would you put forward to address the issue of heart health in your community, country, and within our communities?
It's just improving health literacy and improving health communication. And as we mentioned before, starting with youth programs, youth education programs, youth support programs. Also, we have to allow the youth to participate in national development. We have a couple small civil society organizations in Jamaica that are youth focused, like J1, which is Jamaica Youth Advocacy Network. And they're gung-ho, very strong and very enthusiastic about getting the school nutrition policy on board and making sure people know what's in their food in terms of labeling and that kind of thing. So it's just more of the same. That is how I would put it.
Sorry, I was in these comments. So just getting back to Miss Weaver, she says she lives in the US, but she is from Bimini. Okay, Miss Weaver. So what are your thoughts? I'm just interested to hear your thoughts on heart health, Miss Weaver. And where you are located in terms of, you know, are you able to, in terms of items and you know, how does it impact you? I just want to hear your opinion. And Reen is saying, right, food is important, but it's the principle behind it and the consequences of the overall health of the population. I'm thinking she's referring to the delivery of those items, and as you would have spoken about, to healthcare workers that may not necessarily be the most
Yeah, but
conscious
it's
things.
important. So nobody's saying no, nobody's saying no, but it's just, just a concern. It's just a
Yeah.
concern.
Yeah. I want to thank you for sharing that. And then she also said that government needs to take an evidence-based approach.
Exactly.
And so, so I want to thank you. And I want you to read, if you can, or talk about those recommendations just a little bit. Again, I know you kind of glaze over them, but those are some important points. They're very important. So,
right.
If you can,
Your former, the previous lady that you talked about, she made a very good point. Evidence-based is where we go. We have the Jamaica Health and Lifestyle Survey. So all the data that we have about the persons with hypertension, who has diabetes, the persons, we are 52% overweight and obesity in the adult population. And in the youth population, it has grown maybe 50% in the last 4 years. So we have the data. We have how many people have diabetes, how many people have hypertension, how many people are overweight, and we know that overweight, has a direct knock-on effect to the NCDs and heart, heart problems and all the cardiovascular complications. So because of that, we also know from the statin data what is the age bands, like 0 to 10, we have X, 10 to 20, all of that is known. I'm sure it's known in all the countries because all the government. So you could target the public education to the different age bands because clearly what you want for, say, a 60 and over public education is different from what you want for young people. So it has to be targeted to the age group, and some sort of arrangement needs to be made because if you know X% of people have heart problems, it's also delineated by age. So between 20 to 40, the percentage, and 40 to 60, and so on. So you also have to tailor the health systems, the clinics, the centers would have to kind of know, okay, just spend more focus on this group versus that group, and so on. And just generally, accessing healthcare is very challenging. It was challenging before, but to me it's even more challenging because such a big chunk is taken up by COVID and all the complications of COVID, which of course have been exacerbated. The persons with overweight and cardiovascular conditions were actually higher risk for COVID and had more severe symptoms. All the studies have been showing that as well. So you're more likely to have a severe condition with COVID when you have, the NCDs.
Thank you for sharing that. And I wanted to ask you your advice. Maybe someone who may be impacted by heart health issues. Is there any advice that you can offer or give to that individual?
Maybe the advice, Deirdre, is to know your numbers. Know your numbers. Go to your doctor, go to the Heart Foundation, go to the Bahamas, clinics, wherever. Go and get your numbers, your blood pressure, your blood cholesterol, your fasting blood glucose, and your body mass index. Those are the things. Now, that alone is not going to especially give you the whole story, but it's a start. So if you go and you find that your blood pressure is normal or just barely high, then you could cut down on your salt, try not to eat so much fatty food, exercise a little more. Even the cholesterol, you can start drinking oats. I mean, there are many options that you can do that are diet related and exercise related, and just see the difference. But again, it has to have a level of motivation. Like I was telling you about this guy who stopped smoking because his daughter was so upset, and that was the motivation for him to stop smoking. So what would it be for people to eat healthier or exercise more? What is the motivation? It's difficult. And most times, or some of the times, it's when they get a challenge. We had somebody that I know very well. He was the mechanic for my car and my family's mechanic. And he was a smoker and, thing. And he had a heart attack. But God was good. His garage is about 3 minutes from the Heart Foundation. And when he felt the pain, he rushed up to the Health Foundation. Lucky thing, they were able to do an ECG and send him straight to University Hospital, where he got a stent and he was able to be fine. And since then, that's a different man. I mean, he clearly would never smoke again. He started exercising, eating healthy, but that fear and that scare, he was saying, Barbara, on the way to the hospital, the pain that he had in his chest, he thought he was gonna die. He was saying, "Oh, I give over my life to the Lord and whatever." So unfortunately, sometimes it happens when there is a crisis. But what we're trying to do is to have it before we get to the crisis, if it's possible. If it's possible, you know.
Thank you. Thank you for sharing that. And jumping back to the comments again, Ms. Weaver says she lives in Washington, D.C. area, and Whole Food stores are everywhere. She says she is a pescatarian.
Fabulous.
But to be honest, it's all how you prepare your food and avoid using ingredients that is high risk for diabetes.
Exactly.
So do you have any comments for Miss Weaver?
No, I'm totally agreeing with Weaver. It's little thing, just like I said, if you steam or bake a chicken versus fry, you know, if you when you're doing your rice and peas, use half the amount of butter that you would normally use, or substitute with a little coconut milk. You know, if you switch your oils, that kind of thing. You can do scrambled eggs instead of fried eggs. You can eat one slice of toast in cake instead of two. You know, it's all about little changes. And one of the big changes our nutritionists will tell us, and we have heard this, many of the persons that come to them who have weight issues or heart issues, they have said to them, stop drinking sodas. And one of the nutritionists told us 90% of the people who come back for their 2-week checkup who have stopped drinking sodas lose weight. 90%. So something simple as switching to water. Now, you don't have to have water. You can have coconut water, small amounts, or you can have infused water. This is what we do now. We get a container, we put in some melon and some oranges, and put the water in it, leave it overnight in the fridge, and the next day you pour it out. So you get infused water, you get the flavor of the water, but without any sugar or any, you know. So there are other things you can do. Some people, if they do have a soda, they'll have a half or put water in it. But remember, if you put water in it, you still can't drink the whole thing. You have to drink half and half tomorrow. Don't think because you put water in it, it's better, because it's the total amount that you're taking, you know. And Whole Foods is great. I wish I had a Whole Foods in Jamaica, because they really have options for you. Again, one of the things you're looking at is plant-based too. To have peas and beans, you know, soy and so on, and maybe not eat meat every day, especially the meats that have high fats. And it's just a choice. And it's just a portion thing. It's another thing is a portion control. It's that too, in terms of what, you know, you go overseas, like for holiday, you go somewhere, and when the plate comes, the food is like this. So you could eat that, you know. So I'm totally agree with this, Weaver.
Thank you. And I want to thank all of our viewers for commenting, Rainbow, Ms. Weaver, Ms. Pitta, and thank you all of those who may not have commented, but you're watching. We thank you so much for joining us in this session. And it's so important. And, you know, we talked about it a little bit earlier, Ms. Mcgraw. We talked about it. I hope I'm calling your name correctly. I get a little scared.
No R.
Okay.
Mcgraw.
Mcgraw. Okay.
That's fine.
We talked about it a little bit earlier as it pertains to our community, not just Caribbean, but sometimes maybe in the Black community as well. We like a certain type of food. We like our seasonings. We like our salt. We like certain things.
Yes.
And so it's so important for us to have these conversations and really talk about the impact that it has on our health. This is something that is kind of ingrained, you know, and it's hard to change those habits. You know, we used to our macaroni and cheese, our potato salad. We used to those things. We used to those things, Ms. McGaw. How can we get out of that? How can we get out of that?
It's challenging. It's just that you have little shortcuts. one of the things I found helpful recently for me is the air fryer. You know, because everybody was saying, oh, air fryer.
Yes.
The chips in the air fryer, and it's not exactly the same, you know, but it's crunchy and it's not soaked in oil. I don't really eat much meat, but I have a friend, she does fried chicken, roll it in the flour and she puts it in the air fryer. No oil, just spray on like a little bit. So that's another way you could try, to have less fat, less fried foods, but still having the fried type of thing. But it takes a little working, and it's a new recipe. You have to learn that, you have to have time to work through that, But the marketing of the industry is also a challenge, Deidre. And of course, it's a legal industry. We can't say they can't do it, but it does play a role. Because you might be on the way home and you hear that fast food ad, oh, come on, babe. And you stop on the way home because it's easier to do that than go home and cook. Especially since COVID and everything locked down, and it's just a lot of confusion. Some people, and the other thing is that the fast food is very inexpensive comparatively. I don't know how they can charge what they charge, so to speak, because it is I would say very inexpensive, but it is inexpensive in comparison.
Yeah, definitely.
And that makes it easy.
Definitely, that does make it easier. That makes it easier for you to just go in and buy that chicken and be done. You don't have to go stand up, and so it's a lot of things that has to change.
Yes, definitely.
Yeah. So, do you have any additional comments you would like to add? And thank you for mentioning the air fryer as well. One of our Ms. Weaver said that air fryers is made things a little bit more convenient, and as you said, it's removing the oil. It may not have the exact same taste, but it's much better.
It's close.
Yeah.
And you can do. They have many recipes. You can just go on YouTube and look for air fryer recipes. Even fish. Escovitch fish, which is our thing, can be done in the air fryer.
You can do escovitch in the air fryer?
In the air fryer. But what happens, you fry it first, then you put on the sauce. The sauce. So you fry it first, and then you put on the pickle after. But it can be done. We do either fish fillet, like the pieces of fish fillet. We just lightly dust it with, say, almond flour, or loaf, and then we just put it in the air fryer, and it fries and it gets crispy. Okay. So it's. I'm just learning because we just got one, but I'm just saying these are the options. Some of the options that could do.
Yeah. Definitely. Mm-hmm. So, do you have any additional comments you would like to add as we wind down the session?
I just want to thank you for having the interest and the passion about healthy eating. I believe the more we have conversations like this and the more persons that are interested in doing that, the better it will be. And the third thing, the most important message is to get to know your numbers. And the next one, children opportunity. So if we still have an opportunity with younger children to try to get them to eat healthy and try to get them to, exercise more, be outside is very important because things have changed a lot in the last few years, I would say.
And speaking of the children, one of the grandkids, Mr. Logan, is saying hi from Florida.
Okay, fantastic. Hi, Logan.
Awesome. So these
That's my grandson. That's my grandson.
Yes. He's saying hi from Florida. So thank you, Logan. Hi. And so I want to thank you. I want to thank you also for being passionate about these things. You talk about the impact of non-communicable diseases on heart health. You also talk about, being the controller on the tobacco, council. So that is even important. And that has an impact on health as well, and negative impacts of that as well. So I want to thank you for sharing these important information. I want to thank all of those persons who may have commented. If I didn't get to your comment, I do apologize. I want to thank you for viewing in, and I want to thank Logan. Hi, Logan. Thank you for dropping in. You came in at the end, Logan. Thank you for joining us.
Yes, Logan and Mommy, I'm sure.
So So I want to thank you again. And if there's no further comments, or would you like to share a page, Ms. McGaw?
Well, the Heart Foundation website, I could, but because I'm on my phone, I wouldn't be able to do that. Remember, I had to do a quick switch. But it's heartfoundationja.org. People just look that up, heartfoundationja.org, and it has lots of information about being healthy, handouts, fact sheets, and a lot of information about our project as well.
All right, so I want to thank you for those facts today. We certainly enjoyed our talk. And listen,
Yes,
you are our friend. You are welcome back anytime, Miss
Sure, thank
McGaw.
you. Thank you so much.
And listen, when you come back, let me know when you're gonna get those fritters, okay?
Yes, the confidence under the bridge. Oh boy.
Let me know.
We have a low fat confidence.
When I come to Jamaica, I need you to take me around and show me some good.
Tell me where you're coming. I'll take you to the beach and we're going to eat some fried fish.
Hey, I love that. I love that.
Okay then.
I'd like to thank you. I would like to thank our guest, Barbara McGaw. I would like to thank our viewers for listening in. Like our page for future notifications of upcoming talks. Comment under our videos. We love to hear from you. We want to know your thoughts. We want to know what you want us to talk about. You can also subscribe to our YouTube channel, Can We Talk? Follow us on Instagram, Twitter. We're on LinkedIn. We're on TikTok using the addresses provided on our page. Thank you, and Can We Talk?
Bye. Thanks.